Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm really pleased today. My guest is Rick Stevens. Rick is the Chief Technology Officer at VISPA, V-I-S-P-A. VISPA is a leading-edge healthcare workflow development firm really just located up the road from me here in Winston-Salem, North Carolina. VISPA brings a collaborative approach to the development of revenue cycle management software solutions. Rick has spent over 20 years working in database consulting and enterprise application development, and he's widely recognized for his excellence in software development, project management, and leading-edge technologies. Rick, welcome to the show today.
Thanks, Jim. It's great to be here.
I think we've got a really pertinent topic. We're recording this in early 2021. And so our topic I'd like to focus on today is what we might as well call the 2021 revenue cycle IT checklist. Specifically, what technologies revenue cycle leaders should be evaluating in 2021. We've got a lot to cover here, such things as machine learning, robotic process automation, analytics, smarter outsourcing of collections, that's a big one, and cybersecurity. What could be bigger than that? So let's dive right in. And so, Rick, let me just throw a high and fast curveball at you. What was the high-level impact of rapid technology implementations in 2020?
Right. Well, I think we all know COVID-19 was that curveball you're talking about. Healthcare providers were now faced in 2020 with a sudden need to support revenue cycle teams working remotely, not to mention a drastic change in their patient volume and the resulting cash flow challenges that it brought. So as a result, we saw healthcare providers rapidly deploying technology improvements, processes that would have taken them potentially even years to evaluate IT solutions. We saw those times greatly compressed. And I believe those experiences and the ongoing momentum around that will lead healthcare organizations to continue on that route in 2021 with faster IT purchases and faster implementations, especially in the space that I'm in, which is revenue cycle.
One thing you touched on there is the impact that the COVID pandemic had on this domain, Rick. And certainly a lot of folks who were reporting to an office or healthcare entity, suddenly they're working from home. So that was a big thing. But then there was that fundamental, almost foundational shift where a lot of these healthcare entities suddenly had their revenue reduced 60, 70, 80, or 90% in a 1 week period. And that kind of shock to the system was certainly not expected. And so there was not months to get ready for that. It was literally in 48 hours, things had to happen.
Right. We certainly saw that happen. And I think, as a result, a lot of these technology points that you and I are going to be talking about today are really being brought to the forefront. For example, starting with the last item you mentioned, cybersecurity, that was certainly a big point that became huge as with workforce working from home. So the threat landscape drastically increased for these healthcare organizations by having people on their internal networks that are now connecting in from home. So, a lot of these topics that we're talking about are going to be pertinent.
Well, so for 2021, what do you see as really the first item on our checklist for the revenue cycle?
Well, I think it's machine learning. I'm remembering back to 10 years ago or so when cloud computing was all the buzz and everybody wanted to say they were using the cloud. Many at the time didn't even understand what that meant, but it was the topic everybody was talking about. And we're starting to see that, especially in healthcare, around machine learning. And, machine learning technology is becoming much more approachable. You don't necessarily need a a PhD in math or to be an expert in linear algebra to take advantage of it anymore. The cloud services out there are creating tools that really kind of lower that barrier to entry to be able to take advantage of that technology. But, healthcare is a prime candidate for it because of the large amounts of data. So, taking revenue cycle, for example, we could create a machine learning model that looks at various aspects of the data, being payers, dollar amounts on the claims, procedure codes. We can compare that data to outcomes such as payments, adjustments, and denials, and take into account any activity on the accounts, like a rep following up on the claim, or was the claim rebilled, or what was a claim status result that maybe came in electronically, or was no action taken at all. And that model, then, we can take all of that and learn what activity for specific combinations of inputs results in the desired outcomes. And then we can feed those learnings back into the system to make it smarter and help guide each case to the best outcome. We want, in revenue cycle, we want to minimize the human touches on an account while still collecting cash as fast as possible. And the exciting thing to me is the answers and how to do that are quite possibly just hiding in the vast set of data we already have, and machine learning can help us to unlock those answers.
It sounds what you're telling me, Rick, is that the proper view and analysis of this data can help generate best practices, and then those best practices can be put into place as far as workflows go. Sure.
Yeah, and with machine learning, it can be this feedback loop where those best practices are being constantly discovered and then getting fed back into the system, so it's continually getting smarter. Is
that actually starting? Are we seeing that now, Rick? Or is that over the horizon?
So we're seeing it in a lot of systems now that it's starting to get built in. Now, just like it was with, other buzzwords from, IT years past, it could be marketing in some cases. So, in some cases, we need to make sure that the solutions that say they're using machine learning really are and really understand what that means. But because it is becoming a technology that's more accessible, it's becoming easier to deploy. I know at our company, that's one of our biggest focuses for this year is building machine learning intelligence into our product.
Let's move on to the second checklist item for 2021.
Yeah, I think in 2021, we can continue to see a lot of expansion of robotic process automation, or RPA. That's certainly not a new technology. It's been around a long time, but there's still really a great use for it. So in the case of especially legacy systems and for the healthcare provider might be using, those systems may not have the capabilities to talk to each other efficiently. So what does that result in? You have staff who are doing, a lot of manual work, potentially in some cases even just looking something up in one system and typing what they see into the other system, often just very repetitive. And so that's a good case for RPA, where we can automate those kind of manual steps and allow those human knowledge workers to manage the exceptions and work on the things that bring more value. We've started to get into this ourselves, and we implemented a bot recently for a patient access group at one of our clients for processing insurance eligibility verifications. And on the first day that it went live, it resulted in a 55% reduction in just manual workload. The team was finished with their work for the day at 11 a.m. So it's a good problem to have.
Yeah, it is.
So it's pretty exciting. We're going to tackle medical necessity next, and there's a lot of manual work there. We're expecting to see, for this particular client, an 80% reduction in the amount of work they have to do there. So because of these kinds of results, it's, RPA is still a very pertinent tool. It's a very great technology. I think we'll continue to see large adoption of it in this coming year. And the tools that, are available for RPA, the technologies just continue to get better and better. You don't have to be a programmer to work with a lot of them. And then there are even open source options out there. you don't necessarily have to be paying hefty fees. So it's still a very viable technology, and it can bring a lot of improvement to processes.
Let me give you a real world scenario, and you can tell me if it's relevant to robotic process automation. We're in January 2021 as we speak. And so I imagine just about every patient that goes to see their healthcare provider, they have to present, or they're being asked, do you have the same insurance? What's your eligibility? Has to be verified. So I know that may be done on a routine basis, but certainly at the beginning of every year, that's a pretty common thing. So is there some way to automate that process, or is that just going to have to be done kind of with, being in touch with humans more or less, as you mentioned earlier?
Right. Yeah. And I know I always find that very aggravating myself when I go to the doctor and have to provide all this information again. And I think a lot of times what is happening there is there are just so many different systems in the mix, and the provider is just trying to make sure they have the latest information, across the board. Where RPA can be helpful is you perhaps manage that in one place, right? And then you use RPA to sort of propagate that wherever else it needs to go, or you use RPA to trigger other processes in other systems, based on perhaps a change in that information, rather than capturing it on all these different places and then having it be entered in multiple places. Then you can come up with data integrity issues. And that's one nice thing. If you have a bot that's doing a lot of this work, it's not going to type something in wrong. You're going to have a more consistent. You're going to have consistency in your data. And so when you're talking about something, let's just say it's like an authorization code for a procedure. If a human gets that over the phone from a payer and types it in wrong, well, that could result in a denial. But if you had a bot that retrieved that through some RPA process, it's not going to get that wrong, and then it decreases the likelihood of a denial downstream.
In terms of your company, VISPA, who are your customers? Are they large hospital systems, or who are your customers?
Yeah, our primary customers are hospital systems, yes.
And so part of that revenue cycle management, of course, is dealing with reimbursement, whether it's come from Medicare or other third-party entities. But there's an aspect that includes, maybe a little bit harder to get reimbursement for, and that's for the patient payments. Mm-hmm. Is there any way that, I think the goal always is to have as many channels and avenues open for patients to make a payment. And so is there any way that, we've got all these new technologies that are, I guess, thrust upon us, PayPal and Zelle and Venmo, those kind of things. Do you see that being expanded more? Maybe not directly applicable to your software application, but just in general, how patient payments are received?
Yes, definitely. In fact, one of our goals is, and you had mentioned earlier, sort of automated outsourcing of accounts. So if I'm a hospital system, I may have a number of accounts that are self-pay. We need to collect directly from a patient. And, as a hospital, that may not be my forte, but there certainly are organizations where that's their specialty. And they have stood up exactly what you're talking about, all these payment gateways and ways to allow a patient to pay by text and all of this great stuff. So instead of the hospital trying to deploy all that themselves, I could see where in a system such as ours, it's recommending to them the accounts that should be pushed out to another organization for the best capturing of those payments. So it could be they set up rules and they say especially it could be at 120 days or approaching 120 days, or in a certain dollar threshold, certain types of scenarios. The system itself could say, hey, we recommend that these be pushed out to a vendor who specializes in taking patient payments for these types of bills.
And that kind of goes back to that machine learning you were talking about, the system itself analyzing that data and see when it's appropriate and what the appropriate intervention or next steps are.
Yeah, and then based on the results that come in, now the system can get smarter, and the next time it's recommending accounts to be outsourced, it's already taken into account that history and learned from it.
Rick, what other technologies should revenue cycle executives consider as we move into 2021?
I think there's, you just mentioned analytics a moment ago. I do think that there's an opportunity to do more in that area. So, I think everybody is, especially large healthcare systems, they're using, business intelligence tools to have, some fancy analytics and dashboards, but oftentimes those could be very siloed, just very department specific or focused on a very just narrow focus within the organization. I know our organization wants to be kind of in the heartbeat of the whole revenue cycle, all the way from sort of that pre-registration patient access side all the way up through following up on claims. And so if you can be in that spot and you have visibility to patient accounts as they move through the entire revenue cycle, well, now you could build analytics that are very holistic, and you can be seeing how our activities on that front end affecting what's happening on the back end, and what's working and what's not working. But even so, I think most executives and directors will tell you they simply don't have time to go review a big library of dashboards and tease out some conclusions from them. One thing I think we'll see more of as a result is, I don't know if this is a term in the industry, but I use it. I call it push analytics. And the idea being that, if I'm a leader in this area, just alert me when there are things that need my attention, kind of like the outsourcing we were just talking about. But things like if something crosses a threshold, just like your car notifies you when your gas level gets down to a certain level, it's not constantly telling you, and you don't have to constantly look. You just get told when there is, something that you need to take action on. So why not approach analytics in the revenue cycle the same way? Let's assume things are running okay, but let us know when things are out of bounds.
Talking about just the general field of revenue cycle management in healthcare, it varies so much from country to country. I'm sure in Great Britain, revenue cycle management does not have to be nearly as complex, or the challenges are not as high as they are here, where we have so many different payers out there. And not only so many different payers, each payer has numerous different insurance plans and different levels of deductibles and all those kind of things. So very, very complex here. And so I can remember the 1970s when for hospitals, the DRGs, diagnostic rated groupings, came in. Somebody came in with pneumonia, and if you're a Medicare patient, the government would pay X amount. Kind of then moved on towards concepts of capitation, where individuals, insurance companies are given, or provider organizations given a certain amount of money per patient per year. And so that changes over time. And then we have the Affordable Care Act. And, 5 years from now, who knows what those situations will be. And so I would imagine that the entire revenue cycle domain for healthcare has got to be, ready to pivot based on just the underlying regulatory environment.
Right. And it's certainly not getting any simpler, is it, Jim? It just keeps getting more and more complex, more and more requirements. Providers are having to implement expensive, complex systems so that they are coding claims properly, so that, they're reducing the chance of a denial. So often I think the denials are it was just a coding error, or just just some nuance in how the contract is written. And so because it went this way, it got denied, and, one little tweak and rebill it and it gets paid. Well, that's a lot of wasted time and effort for the providers. So yeah, I would love to see that get simplified. But in the meantime, I think we just have to use the data we have and just try to streamline the processes so that, there's just more intelligent use of the data and the systems we have at hand.
I think that's you're right, Rick. It's certainly getting more complicated, and I don't see in any way it's going to become less complicated anytime soon. In some fields, you could go after the 80% and ignore the 20%. And so, but in the case of healthcare, revenue cycle management, you can't ignore the 20%. You have to have the capability to handle the insurance and proper coding, even if only a couple of your patients have a particular insurance company. So you really have to have a net with a very fine capture rate, because you got to take care of all those insurance companies. You got to be able to bill them all electronically.
Yep, that's completely right.
Before we've got about 4 or 5 more minutes here, Rick, but before we finish, I'd like your final recommendations for consideration by revenue cycle executives in 2021 in healthcare. What are your final suggestions for the year ahead?
I think I just finished with kind of what I mentioned at the beginning around cybersecurity. So staff working from home broadens the attack landscape. Instead of just securing the office network, hospitals are now vulnerable for home networks. Home networks have other devices, including IoT devices like smart fridges and smart TVs that are all hooked up to their network. And as soon as that employee connects to the work network, there's an exposure risk now. So that attack landscape has gotten much more broad. That is where cloud technologies are ideal, because they already have that. They've already been built with that security in mind. So rather than having employees needing to connect in remotely to their employer's network, they're using solutions that just require internet access in a browser. That alleviates a lot of the threat risk to internal IT systems. So that's becoming more important than ever, as well as just being very diligent in policies, procedures, watchdog tools around cybersecurity in the organization. We expect this year that there will be new HIPAA guidelines. That'll play a role in the efforts in 2021 around what we do with cybersecurity. We don't expect to really see what those will be until later in the year, but we can look for stronger language around securing PHI, being more specific on the approaches that need to be taken from an IT standpoint to secure data, and how to bring HIPAA compliance up to 2021 standards. So that'll be a big topic in 2021. And really, Jim, of all the things we've talked about today, none of that really matters if we aren't taking security seriously. All of these solutions need to be deployed with strict security practices in place.
You talk about those practices, and a lot of that is human training and human actions. People being educated that if they get an email, don't not automatically click on that link in there, because that can infiltrate the entire network. A very, very simple thing can happen. That I think you used the phrase landscape. Was it security landscape? But very, very appropriate risk. Risk level there, and it doesn't take too much to really infiltrate these systems if a human has not been trained in these cybersecurity protocols.
Right. I was in a seminar earlier this year for cybersecurity, and these large Fortune 500 organizations were talking about what's worked and what hasn't worked, and one of the biggest success factors was exactly what you just said. It was honestly ongoing training and awareness for the workforce, so that they would understand what is a phishing attempt. How do you spot it? And then some organizations were actually giving out rewards and recognizing people who recognized that there had been an attempt and they took the correct action, and then they got rewarded for it. And it became a teaching moment for everybody. Hey, look, as an organization, we could have, we could have fallen prey to this, but through some, just diligence and just understanding by our workforce, it was avoided. Now, of course, ideally, that never happens. That they never even see that email that is malicious, but it happens, and so we have to be prepared for it. So absolutely, I think in addition to IT systems and really good practices, just some education goes a long way.
Absolutely. Well, Rick, I can't believe it, but our time is almost out here. I want to definitely let our audience know that to find out more work that you're doing and that VISPA is doing, VISPA, you can go to their website at vispaflow.com, VISPAFLOW.com, vispaflow.com. To our audience, thanks for joining us on this episode of the Tate Chronicles. I offer a special salute to my guest today, Rick Stevens of VISPA. Rick, thanks so much for coming aboard today.
Thanks, Jim. It's been good to talk with you.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.